But we have heard 4 examples from both UN agencies and NGOs who've had different approaches to real-time evaluative exercises, but also we heard a lot of similarities. So we have approximately 20 minutes to take questions from the audience. So I'm going to go really quickly and see kind of some of the questions that have been voted on the most, and then I will put them to the panel. Okay, so I'm going to take a question now from Juan Carlos Alegre. I hope I'm saying your name right. So as RTEs are least appropriate to assess efficiency, impact, or coherence, as noted in the real-time evaluation to real-time learning paper, are RTEs mostly focused on adjusting processes and outputs rather than outcomes and end results or impact? Okay, so it's a little bit of a complicated question. I'm going to go to Margie, I think, as the co-author on the paper. I think it goes to, what actually areas of the DAT criteria perhaps are RTEs and real-time assessments, real-time learning better able to address rather than outcomes and impact. So let me go to Margie, and if any of the other panelists want to respond. And maybe let me just take one more question as well, actually. Okay, so there's also a question on how do you reconcile less rigorous results with adoption of findings from RTEs by decision makers? Can you illustrate the response with 1 or 2 examples of real life? Okay, so I think that this also goes back to the thing of there's a spectrum and maybe a trade-off sometimes between rigor and timeliness. I'm just going to take one more question here, and then I'm going to put some of these questions to the panelists. So panelists, you can also see in the Q&A. Okay, so there's one that's a bit maybe of a challenge to ALNAP, I realize. So it says, despite a lot of talk on localization, I still see that real-time evaluations are still framed mostly as a way to capture findings for global consolidation. What would truly localized real-time evaluations look like? Sorry, and it just moved for me. So it's this question of what would a localized real-time evaluation look like? So I think maybe I will just mention that we're at ALNAP thinking of doing some scoping work on localizing evaluation practice, and I'll leave it there. But let me go to the panelists. Maybe, Margie, I'm going to start with you, and then maybe if we can go to Jamo and Ricardo. There's too many questions, I think, but if you can answer some of these questions, let's go for that now. I would take a round of responses, and then also there's this option later that we can kind of type some of the responses in. So Margie, over to you, particularly on that first question of, what are real-time evaluations and assessments kind of most suited to look at? Yeah.
Great, thank you. And it is a really good question. And I think this is where, there's a number of answers to that, but I think the phased approach has been particularly interesting because I think what happened certainly with the COVID-19 real-time learning exercises was a lot of the very quick RTL exercises that were initiated sometimes within weeks of the pandemic kind of taking a grip, but sometimes within a few months. I think those did focus a lot on issues of, process, adaptive management. Are we adapting appropriately? The revised guidance that we're perhaps putting out to country offices, is it working? Is it useful? So I think there was quite a lot of focus at that point on process and to some extent on outputs. But I think that where there was a phased approach and then there was a follow-up with more of a deep dive or more of a kind of follow-up at sort of country level, I think that was an opportunity to look more at kind of outcomes. And to be honest, I think one of the biggest challenges with the RTL exercises in response to the COVID-19 pandemic was the lack of access to community level. And I think that's super interesting because I think some agencies managed to get around that better than others. But I think one thing about RTLs is that it's an opportunity to support and find out if program teams are able to capture outcomes on an ongoing basis. Because even if you do a final evaluation, if data hasn't been collected on an ongoing basis, it's quite difficult to assess impact, you know, even if it's sort of 2 years later, unless you have a really, you know, a really big sort of impact evaluation. So it's a way of checking of how much of that kind of data is being collected on an ongoing basis, and how could that be strengthened. But at the same time, and I'm sure some of the panelists might be able to answer this, by talking to staff on the front line, talking to partners, and reaching communities, maybe through key informants, it is possible to start to gather some findings and some evidence on outcomes. So I would say don't lose that or don't ignore that. But I think it depends what the focus of the RTL exercise is going to be. But I would go back to that kind of the advantages of the sort of phased approach. So let me pause there.
Okay, great. Thanks, Margie. And I just saw kind of around this issue of localization, there was a similar question posed by Alexandra Warner, which is, did any of the panelists support local partner organizations in implementing their own RTL processes? And how would this be different from UNINGO? So anyways, I see a lot of interest kind of around localization, and then there's some questions more around engaging kind of at the country level. And so I know, you know, UNICEF, I believe, has a more decentralized evaluation system. And I think World Vision, you did a lot at the country level. So maybe, Jema, do you want to come in and talk a little bit about that, of maybe how you tried to engage with local communities more? If you have anything to share on that, Jema.
Sure, thanks, Susanna. I think it was, as was mentioned earlier, really difficult to be interacting with community members. I mean, that was one of the challenges of the pandemic, right? So for our process in offices where that was possible, we certainly did that. In terms of engaging like local partners, we had lots and lots of input from local partners, which is not really addressing Alexandra's question in terms of supporting local partners for their own evaluations, but we certainly had lots of input from our local partners around how our joint work was taking place, and you know, what was working and what was working, what wasn't working. I think what I also wanted to say something about, you know, in response to what Margie said about outcomes. I think one of the components in our rubric that each office looked at was how likely they were to meet their objectives that they were setting out. And so although we weren't able to measure some of that in the communities, each office was able to take that question and really wrestle with where they thought they were, and using the input from the staff and from the community members and from partners. Did they predict that they were likely to meet those outcomes, that they were striving for their objectives? And if not, and if collectively they felt that wasn't, that they were sort of not heading in that direction, then they had the opportunity to make some different choices at that point in their response. Thanks.
Okay, great, thank you. And maybe I'll just take the opportunity to plug that ALNAP is actually recruiting a research fellow to work on localization. So please share that widely. The post is open, and we're interested in this issue of localizing evaluation and evidence practices. And we need to find a really good person to help us lead on this. So I'm going to read one more question now. So this is from Yue Chorus, who I think works with CARE. So he says, in my experience, the priority of many RTEs is finding quick fixes and fighting fires. Not much room for internalizing learning. Obviously, for later learning, it's important that we document the lessons during the RT so they can be learned. In your experience, how best can we connect RTE with later learning exercises? So I'm going to put this question to Ricardo. And Ricardo, if you want to answer any of the other questions that have been brought up, please do. So over to you, Ricardo.
Thank you. Let me start with Uwe's question, and let me rewind a bit. And let me go back in time, if I may. I remember back in Pakistan, we had 4 interagency RTEs, or 3. And we came up when we did the floods RTE in 2010, or in 2011. 2011, yeah, and there were 4 interagency RTEs. We came out with the fact that all of the humanitarian system just was experiencing chronic amnesia. So there's a deficit in learning in the humanitarian system. And I think John, back in the days, was a very big advocate to put learning at the fore. And I think that's the essence of ALNAP. You know, you can't have all these crises and then just move and zap from one crisis to the other without having any form of systematization of learning. Now, RTEs function very differently across the humanitarian system. There are those that we did back in 2010 that Francois led in Haiti and I led in Pakistan, that were the basis for the humanitarian reform across the UN system. So those are 2 RTEs at a point in time. You know, you had emergencies of a certain scale, so you have all the L3, so that's a certain dimension of RTEs. Now, the adoption of RTEs is very different across the board. And I think that depends also on what kind of learning culture you do have in your respective organization, what space there is for learning, and how seriously do we take learning in our organizations? What is the level of investment as opposed to a box ticking exercise? But that merits a full webinar, I think, you know, just that question away. But I would like to touch a couple of other points. I think Juan Carlos raises a very fundamental issue. And I think in the midst of a crisis, there are very few organizations which have very clearly laid out theories of change of what results they wanted to achieve. Very, very few. Some had regular ongoing program, but the key issue there was, what do you prioritize in the midst of the program? Do you prioritize your long-term development program, or do you prioritize the new response, the new priorities, and how do you link the two? And I think there the evaluators have to take a very much developmental focus approach on trying to connect the dots that often are absent, because often these things, there are very few organizations that are light and adaptive as we wish. And there the spectrum are for smaller NGOs that are more localized to bigger and larger scale bureaucracies, I would say. But that also merits another webinar. And finally, Alexandra's point on the localization. We did some work on behavioral change and communication for results at community level. Back then, I remember in April 2020 in Cambodia, when I was in Bangkok, and that had a lot of adoption across the board. And it was basically, how well are messages going through? How are we managing to change behavior in the midst of COVID of the communities? Now, the full engagement of communities in these evaluation processes, I don't know how much it's been the case, because we've had a lot of remote work. We've adopted do no harm approaches too, not to put communities at risk. But to the extent possible, we've engaged communities in the different exercises we've done. We haven't fed back the results as much as we could, but that is due to the circumstances of the pandemic, not of the lack of willingness to engage in that direction.
Great, thank you, Ricardo. And I should mention one of ALNAP's earlier kind of papers that was looking at adaptations from M&E practice during COVID was precisely on that issue of this move to remote M&E and all the ethics and gaps and challenges. And what we heard was a lot of frustration, actually, around people wanting to engage a lot more with local communities. And I think, yeah, we need to think a little bit further at ALNAP of how do we address this issue going forward. So I'm going to go now to Carlos. So I remember, back many months ago, we did the key informant interview with you and with Masa, who is the head of FAO evaluation. And I think he said something, hopefully I can quote him, along the lines of, we may not be able to reach people on the front lines, but we can do the analysis in such a way that we include their experience. So I think it was something along these lines. You may not remember, but anyways, Carlos, I'm going to go to you. There's been a number of questions that have been asked. If you want to respond to any of these, and I think your RTE is still ongoing. So there's also a question around how do you feed that learning back in? Do you have plans to feed that back in, I guess, at partners and country level, or if you want to respond to any of the other questions. So Carlos, over to you. And I think we have around 3 minutes. Yeah.
Yes, no, thank you, Susanna. And I think, let me say that, these are very important topics, but, this in my mind are not necessarily only because of COVID, no? I mean, these are, I think, as Ricardo was saying, you 10 years or 20 or 30 years ago, we probably have the same question. How do we ensure that people learn in Pakistan about findings that emerge in Pakistan? No, whether it's earthquake, it's COVID, no, or something else, no? And also, I don't want to rock the boat, but I mean, to me, when people talk about localization, I mean, we all need to learn, so whether a global, regional, country, community level, we all should be learning. So it's not localization versus global, no, or vice versa. This is, I think, to me, there's no real discussion on that. But how then, as we know, how do we manage to learn more at country level? How do we manage decision makers, communities, beneficiaries, all to have a say also and to hear back from that? I think that's a difficult question. And as we are saying, as we are talking, I mean, I know a few countries that are leading their own evaluations, governments, I mean, Senegal, Colombia, and others who are doing their own evaluations of their response to COVID-19, in some cases with support of international organizations or involvement of civil society groups or private sector, but in others, no. In others, I mean, I was just reading the report of Bolivia, no? I mean, 3 donors, 3 bilaterals got together, did their own evaluations, but then they share a synthesis of their findings, which is very useful for me because we're doing also evaluation in Bolivia, also the government in Bolivia, with some parts of the government are trying to learn about the response in some teams, in some areas. So I think, yeah, I mean, there are many efforts, no? So I think we just need to push in that direction to try to make sure that this is something that reach eventually, not just decision makers, but I think the beneficiaries. I mean, how we're doing on that? At least in our case, I mean, we're trying to work closely with our colleagues in the field, who are the ones who are in contact with the beneficiaries, and we're trying to promote more this idea of self-assessments. But not self-assessments of their operations, no, but actually of their contributions. The so what question, no? So what change happened after I helped the farmers, giving them more agricultural inputs, or what did they do with the cash they received, no, so that they could, in theory, no, buy more food or buy more agricultural inputs by themselves, no? So I think this is one way we are listening, at least in this small exercise, we're trying to also promote this evaluation culture, no, that I think is at the end of the day, no, at the bottom of this question. Let me leave it there, but thank you. Some very, very interesting topics. Oh, last but not least, I mean, I saw some questions about, is this a glorified version of process evaluation? I mean, to me, and again, don't want to rock the boat, but evaluation is, we have to be after outcomes. That's our added value. Of course, we can look at other things too, but so the auditors, so the operating staff, operational staff, so at program management, but us as evaluators, what we actually bring that is different from others is this push for so what? No? What did we learn? And how can we use that better, no? From outside? So thank you. Let me leave it.
Great, thank you. No, I think that's a good note to end on. I think I will say, yeah, one of the things, I suppose, across the spectrum of the different exercises that we looked at is a lot of the early ones did seem quite internally focused, of kind of how was the organization adapting and changing. And I suppose a little bit later in some, forthcoming ones, maybe we would get more at outcomes and impacts is my suspicion here. And I just want to say then, because it was mentioned, so ALNAP is also working with the COVID-19 Evaluation Coalition, and we'll be doing a synthesis of evaluations of COVID-19. So also, if you have any COVID-19 evaluations, please share them with us, because we have now a portal that we're working on with them to centralize all of the evaluations so we can learn from each other, which is really goes to the core of ALNAP's mission. Yeah, so happy for you to go to our website or contact us if you have COVID evaluations so we can further the learning.